Today I want to talk about one of the most common cancers that I see, and that's canine lymphoma, or lymphoma in dogs. Lymphoma is actually a cancer of the immune system, and we're not exactly sure why dogs get it. We're starting to look pretty hard into genetic reasons as well as environmental, but we don't have an exact reason to point to. So the reason why I start out with that is it's probably owners' number one question when they hear their dogs have lymphoma, is why did my dog get cancer? Why did my dog get lymphoma? What did I do? And right now the answer is you did nothing. So it's not your fault, and we're looking to try to figure out why. So as far as we know right now, it's statistical bad luck with a couple clues leading to why it may have happened, but no definitive evidence. So when dogs have this cancer, once we know they're diagnosed, we try to talk to owners about the big categories of how the cancer presents itself, prognosis, and treatment options. So lymphoma comes in two primary varieties, a B-cell lymphoma and a T-cell lymphoma. In general, the B-cell dogs tend to live longer with treatment, whereas the T-cell dogs unfortunately don't do as well long term. And those are just the big categories. Other things that are going to influence treatment is what's actually chosen to treat the dog, how old the dog is, and a couple other factors that certainly your oncologist can get into when they meet with you. But overall, the big categories are B-cell versus T-cell. So when we're thinking about lymphoma, the next step is, well, how are we going to treat it? What are we going to do about this disease? We know that lymphoma is an aggressive disease and that if you don't treat it, unfortunately within 2 or 3 months, your pet's most likely going to be very sick. And so getting to an oncologist fairly quickly after treatment is quite important. Even if you find that to be a fairly scary thing to even go to see an oncologist, I really think it'd be well worth your time and your dog's well-being to at least go in for a consultation to talk about options. Thankfully with this disease we have a lot of treatment options. There's many protocols out there. So most oncologists are going to break it down into about 2 or 3 main categories for treatment of your dog. A standard of care protocol that they'll offer for you, something in the middle if you have budget or scheduling concerns, and then something very conservative. And so know that there's a lot of options out there for your dog and go out and get a consultation. So that's something I really want to encourage everybody to do. The standard of care treatment for most dogs with lymphoma, whether it's B or T-cell, is going to be what's referred to as a CHOP-based protocol. CHOP is an acronym for the drugs that are used in the protocol, and they're given on a rotation depending on which protocol you actually use, but they're the same core drugs just given over and over again. That tends to be the standard of care, and you're going to find that all over the place, whether you're searching on the internet or going to see your oncologist. Most of it's going to be a CHOP-based protocol. For owners with scheduling and budget concerns, the next step down is typically going to be an every 3-week protocol. These protocols can still be quite effective, about 80% as well as a CHOP-based protocol, but are less intense in that you're not going to see your oncologist as often, and there's less drugs actually used. There's only about 2 or 3 drugs that can be given at intervals of about every 3 weeks, but they do a pretty good job at keeping a lot of these pets feeling well. So certainly let your oncologist know if you have scheduling concerns and you might need a 3-week protocol versus a standard CHOP-based protocol, which can be almost weekly in some instances. For owners that want to be really conservative, there are things you can do at home, but you have to understand that the cost and convenience of doing things at home does have trade-offs and that you're not going to have as long a survival time. So the common thing that we use is steroids at home. Steroids can do quite a good job for about 2 or 3 months, and then unfortunately the cancer figures them out. And so those pets may have a great quality of life and be on a very budget-friendly protocol, but sadly it's not going to be as long-lived as if you did a different type of protocol. So certainly let your oncologist know if you need something very conservative for your dog with lymphoma, or if you'd really prefer to do something more standard of care based. So those are the basics for lymphoma. I just wanted to sit down and present those to you today. That's really what most owners need to get started with, is knowing prognosis, treatment options, and how the protocols vary. Once you meet with their oncologist, they can certainly dial things in for you, and that they have to assess your pet. They need to feel your dog, assess how advanced it is, talk to you, and review your pet's other concurrent health concerns before they can make their final recommendations. So this video alone is certainly not enough for you to know everything you need to know about lymphoma. You really should go in and get an oncology consult, but at least you'll go in knowing about the basics.